Our population is aging, and as a result, older adults need to have their voices heard. There are several powerful organizations, such as CARP and FEDOC, right here in Quebec. And there's also the National Association of Federal Retirees with over 170,000 members right across the country. Well, I have in studio with me Mr. Jacques Lambert. Mr. Lambert is the president of the National Association of Federal Retirees, Montreal Branch. Monsieur Lambert, welcome to Life Unrehearsed.
Yes, good afternoon, Mac. And Matt, thank you for having me.
Well, thank you. And let's get right started. What are some of the challenges faced by seniors as our population ages from your perspective?
Well, first, it's access to healthcare. It's becoming more and more difficult. Many older adults struggle to find a family doctor, not only the seniors, but it's pretty particular in their situation. And waiting time for specialists, home care and long-term care continue to grow. And second, there are financial pressure. We tend to ignore that, but it's a reality. Inflation and the rising cost of housing, food, and medication have a significant impact on seniors living on fixed income. And third, there is a social isolation is a major concern. As people age, mobility issues, loss of partners or friends, and limited transportation options can reduce social participation and affect mental health. So these challenges shows that why we need a coordinated response. The National Association of Federal Retirees has been very clear that aging issues cannot be solved piecemeal. They require a national strategy for seniors with clear goals and collaboration across all levels of governments.
Yeah, and it's really important. There's so many rights of a large part of the population could be younger, it could be LGBTQ rights, and we need voices for seniors. And you're doing a fantastic job at the National Association of Federal Retirees, well over 70,000 members. You're responsible for the Montreal branch. I understand over 12,000 members just here in Montreal. So what are some of the solutions to assist seniors to improve their health and well-being?
Well, there are several concerns or solutions that would make a meaningful difference in seniors' well-being. For instance, Matt, one is strengthening home and community care. Most seniors want to age at home, but home care services need more staff, more funding, and better coordination. Investing in this area is both humane and cost-effective. Another solution is promoting age-friendly communities, safe housing, accessible transportation, community centers, and programs that reduce isolation and support social connections. We also need to invest in preventive health, including physical activity programs, mental health support, caregiver relief, and digital literacy, so seniors can access modern services as well. So all these solutions are central pillars of the National Senior Strategy advocated by the NAFR at the national level of government, the federal government. A strategic plan ensures that these efforts are not isolated projects, but part of a coherent long-term vision for aging in Canada. So it's part of our strategic planning, and we meet the seniors. Right now it's the Secretary of State, Stephanie McMillan, who is the person responsible in the at the government for the seniors. So we met her on the Seniors Day on October 1st. So first time meeting, so just to get acquainted and review the strategic plan with her and seek for collaboration.
Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm talking with Jacques Lambert, who is the president of the Montreal branch of the National Association of Federal Retirees. Monsieur Lambert, the association advocates for the rights of their members. You've mentioned some of them. And one of the more important advocacy topics is that national senior strategy that you were just talking about. And so I'd like to hear a little bit more about this advocacy work and the importance of a national senior strategy.
Yeah, the idea is simple. Canada needs a coordinated nationwide plan to address the realities of an aging population. Right now, policies and services for seniors are fragmented. Healthcare is handled by provinces. housing and income supports by different departments, and community services by municipalities or nonprofit. This creates gaps, duplication, and inconsistency across the country. A national senior strategy would bring all levels of government together with clear objectives, measurable outcomes, and dedicated funding. It would focus on 4 key priorities. One is the healthy aging and access to care. The second would be the financial security and affordability. The third would be the safe, age-friendly communities. I know this is the main target of the provincial government, and they're investing in that area. And fourth, recognizing seniors as valuable contributors to society.
Yeah, I love those 4 pillars, and especially the last one. We've talked about the ageism actually on my show last time,
Yeah.
and the seniors, as you're fully aware, it's becoming a large percentage of the population of those 65 and older. The boomers are aging, and so I love these 4 pillars. Very quickly, I'd love your opinion. I love when you're talking about pillar number 1, healthy aging is so important, yet you brought up home care, lineups, a waiting list to get into long-term care are getting longer, not shorter. Home care. So I love the fact that you're advocating for healthy aging. Can you maybe expand just quickly your thoughts on what more can we do to get the government making seniors have healthier and their well-being better than it is today?
Well, I think it's first accessibility to care. So as I've just mentioned, the services are delivered by the provinces. So we can have an orientation, a strategic orientation, but it's not a federal government that will deliver. So this is why I mentioned that the vision is fragmented, because if we don't talk with each other, how do we invest? Because we need to invest, but how do we need to invest needs more discussion at higher levels.
Such an important point.
Yeah.
It's no use having federal strategies when it's really under the jurisdiction, particularly with healthcare provincially. They have to get together better than they're doing for the sake of all, not just seniors, healthcare in general. So we have to wrap it up. I want to give congratulations to the association. I just saw that Madame Giselle Tassé-Goodman, who I've had on my show running FADUC, is now your chair of the entire association. Is that correct?
Yeah, she was just elected very recently on November 24. So I signed her bulletin to become president, and we're very happy with the results.
Excellent.
And I think it's the first time since 1963 that we have a woman as a national president.
Love it. Félicitations. Great move.
Yeah.
Monsieur Lambert, thank you so much for coming into studio here on a Sunday and joining me on Life Unrehearsed.
Yes.
That's Monsieur Jacques Lambert. He's the president of the Montreal Branch of the National Association of Federal Retirees.